Hello, my name's Casey Yovich, and today I'll be doing a presentation on a task that I was given where I was to research issues that are affecting young people in my local area. This report and presentation will identify a chosen issue that I identified that impacts the local youth in my specific area, and it will also identify the needs of the young people in relation to this issue. It will also suggest local referral pathways for emerging needs of the chosen group. So the local area that I will be looking at for this specific report is the Brisbane area and specifically the Moreton Bay region. Some of the issues that can affect young people in this region include homelessness, alcohol and other drug use, mental health, sexual identity, and health and employment related issues. So, the issue that I have chosen to focus on for this specific task is mental health and how this issue impacts the young people in my area. So, mental health is a huge issue not only in the local area, but Australia-wide and even worldwide. And the research has shown that young people are some of the most affected by mental health related issues. Research shows that before the age of 25, young people are estimated to have experienced about 75% of mental health issues, and according to the Headspace National Youth Mental Health Survey, rates of psychological distress remain high amongst Australian young people in 2021. It's estimated that 1 in 3, so 34% of young people report high levels of distress. Another statistic that I found was that in Australia, around 20% of young people will have an episode of depression in a 12-month period. And some of the common causes of mental health issues in young people can stem from the pressures of their younger years, such as getting good grades, getting a job, fitting into a certain group of friends. The failure to achieve these things may result in feelings of worthlessness and sadness. In recent times, mental health issues have also increased due to events such as the COVID-19 pandemic and also the rising cost of living. In the Moreton Bay region, the issue of mental health is an important issue to take note of, as the area is fast growing and is important that there is enough resources and services to cater for the young people in this area. So, after identifying the issue of mental health, it was then required that I research ways in which these needs can be identified and met for young people. When creating a service that aims to meet the needs of young people in relation to mental health, there's a few strategies and tools that are needed. One main thing that we considered when making our SWOT analysis was accessibility, so that the service can be easily accessed by the young people when and where it's needed. Another strategy is to make the service be as comfortable and welcoming as it can for the young people, due to the nature of mental health being a sensitive topic that young people will only want to come and talk and open up when they feel comfortable and feel like they're being listened to. Another tool that is necessary that we identified in the SWOT analysis is to have the right workers working for the service, ones that genuinely care about the young people and their well-being and are committed to working in the field. So we also identified that when developing our service plan SWOT analysis. These were just some of the factors that were taken into consideration. In terms of referral pathways, we identified that it would be important to have referral partners so that when young people who come to us with more complex mental health needs, they can be referred to other services that can cater for their specific needs and have the resources to deal with the more complex issues. So during the research, it was also found that many of the local services in the Moreton Bay region that work in the mental health field for young people are happy to work together and network to help provide better services and meet the young people's needs. When the young people participate in the program that we developed, we would hope that they use and engage with the service for as long as they need, and if there are deeper issues that we can identify, that we can help them get the help that they need. Some of the services that we were able to identify that we would be able to refer young people in our area to include Headspace, Youth Space Redcliffe, and in terms of young people being referred for mental health services, we found the My Mental Health Service Referral e-link is a good place to go, which gives young people an avenue of where to go to receive support and whatnot. So, in conclusion, I hope that this short report has been able to highlight an issue in the local area that affects young people, and I hope it has shown some of the needs that have to be met for the young people when developing a service for them, and some of the local services that can be used for referrals. So thank you for listening.